Right. Good morning, everybody. Hope everybody's doing well this morning on bright and early on a Monday. For me, it's late, because I live in Fort Lauderdale, Florida. So when I got here last night, it was a little late. For me, it was like 2 o'clock in the morning, my time. But I'm good today. I woke up right at 6, ready to go. So hopefully everybody's feeling good, and we're going to talk about leadership in the clinical setting today. A little bit about my background. I've been a nurse for 31 years. Sounds really old. Oh my God, I realized last year when somebody asked me that, and it was just like right after I became a nurse for 30 years, and that kind of sunk in. I'm like, 30 years? But anyway, hopefully I can bring some years of experience to the presentation and things that will help you out in your practice. I have been in the ambulatory surgery industry for almost all of my career. I started out in an acute care hospital in the operating room for about 8 years. And then ever since, I've been in the ambulatory surgery space as an administrator, as a regional vice president over a number of facilities. For probably the last 15 years, I was doing that. Did some independent consulting in the midst of all that. And currently, I work for the Hospital for Special Surgery in New York City. And I am the VP, Executive Director of HSS Florida, and we are opening a new venture in Palm Beach, Florida. It's the first venture that HSS has ever taken outside of the tri-state area. So we're opening a surgery center, physician practice, imaging, and PT center in Palm Beach. So that's what I'm doing. So I've been running back and forth to New York for the last 4 or 5 months. And HSS, for those who aren't familiar with that, it is the leading orthopedic hospital in the nation, ranked #1 in orthopedics for the last 10 years in USA Today. We do over 44,000 orthopedic procedures a year in New York City. And so it's a factory. I mean, we have a central sterile department. Just to give you an idea, this is the one that really blew me away when I went there. We have 110 FTEs in our central sterile department. There are that many trays going on and going through it. We have 49 operating rooms on the campus in New York. So it's a big place, and I'm bringing some of my ambulatory surgery background to them, and I'm learning a lot of great things from the HSS way of doing things, and why are they #1 in orthopedics? Why is that? So hopefully I can transmit some of that knowledge to you guys today. This does not work. Let me see. Okay. All right, the clicker doesn't work. We have to. So I want to start out just to give a little setting, a day in the life of a clinical leader. This might look familiar to some of you. Start out 7:30 a.m. doctor. Why is it taking so long to turn over my room? Maybe 1 doctor, maybe 10 doctors. Depends on how big your facility is. 9 o'clock in the morning, Joint Commission arrives unannounced for a survey. Oops, it's out of order. I'm so sorry. 8:15, the tech comes to you. The roof's leaking and the autoclaves are down. Nobody's ever had this happen first thing in the morning, right? You've never walked in, stuff's down, air conditioning's down, autoclave something, humidities are 80% in the OR, whatever. 10 o'clock, you have to do a conference call with corporate or your boss or somebody. Nurse, I'm not getting my hours. I didn't get a break. Nobody ever says that, right? None of your staff? That they didn't get a break, they didn't get lunch, they're not bothering you 24/7, that they didn't get all these things, so you're having to manage all this and try and do your job. Oh, shoot. I am so sorry. The clicker is just not working. Oh, now I get the whole thing. Oh my God. I'm having to do this manually. Oops. Let's see. I am trying, but I don't have a mouse. I'm having to use it like it's like, this is technically challenging. Sorry. Right, it goes right along with our slide right here. Okay, let's try this again. Okay, now it's, I don't know what's going on. $11:15, office manager, patients scheduled, not coming back because nobody called them about their copay and deductible, so they may cancel. That happens a lot these days. And, you know, patient's family member, I need an update on my mom. Then your boss, I need X information ASAP, because they always need things ASAP, right? It's a fire drill all of a sudden, gotta have this. Oh God, it's still like, this is really so challenging. Finally, almost end of day, 5 o'clock, 4:30, you can sit down and start to do your paperwork and all the other things you might have to do for planning for for the week, for the month, for the year. Does that sound familiar to anybody? You just got all kinds of things bombarding you all the time. So how do you prioritize leadership? So our objectives today are to clarify leadership role, discuss types of leadership, some tools for success, and we're going to review some desired leadership characteristics and outcomes. Okay, role clarification. Leaders in healthcare settings, typically should be doing the following: driving excellent patient care. That's our number one thing, right? That we are there to do as leaders of a healthcare organization of any kind. Without that, we really wouldn't need to be in existence, because we're there to drive excellent patient care and make sure that all the patients we take care of come out better than they came in, hopefully, without doing any harm to them. Driving growth. We all need to do that in our facilities, because if we don't, and the gentleman in the room before was talking about turnover time and competition. If you're not growing, is your facility, is your hospital, is your job going to be sustainable? Because if you just have to function and focus on growth. Much more, when I started out in the operating room in the late 80s, early 90s, no one really thought about that, because it was like we had all the business. I worked at a big level 1 trauma center. Nobody thought about that. They never talked about that. But the more we go into value-based care and all these other things, you have to think about growth. And also, our margins have shrunk a lot since the 80s and 90s with reimbursement, so you have to focus on growth. Leading and developing teams. That is, in my mind, one of your biggest jobs, and probably takes the most of your time, dealing with the people issues. And we'll talk about that a little bit more, because that can consume, depending on the team you have, all of your time. And how can you get to a place where that doesn't quite consume all of your time, and you've got people below you that can carry out things and do things and allow you to do other things besides focusing all of your time on your team, although you want to keep that focus. But, as you know, 20% of the people can take up 80% of your time, depending on what kind of people you have on your team. And then functioning as a leader, because a lot of times, and when I was in nursing school and even, 10 years ago, it was like nurse managers, right? We're nurse managers. Are you managers or are you leaders? There's a big difference in those two terms, managing and leading. So we'll kind of talk a little bit about that. And you're a leader. You're not although you feel like a manager a lot of times, and you might feel like a kindergarten teacher at times, or a daycare supervisor, but really you're a leader. And how do you model the way? Because everybody that works for you is looking at you to how to do things. Every little thing you do, even though you may not think, people are watching everything you do, everything you say, how you say it, if you're in a bad mood, if you're smiling, if you're frowning, everybody's watching what you do when you're a leader in a healthcare setting. So you really have to think about that and how you can come off in the way you want to your team. People leadership. This is crucial, as you know, because you can't do anything without a great team underneath you. Hiring and retaining A players. That is a really important piece. And how do you do that? Because is it hard for any of you to hire operating room nurses? You have trouble? Who has trouble with that? It's really hard to find these people. It's like we don't exist anymore, and the aging, when you read the literature, operating room nurses are aging out and there's not new ones coming in. So hiring and retaining A players is really, really important, and it is hard to do. I have another topic on this, but how you ask questions when you're interviewing people. That's a big thing. You can teach people skills, but you cannot teach them attitude. And I find that, somebody comes in, and I ask a whole bunch of questions that get to attitude about people and also just their work ethic, like asking them, how do you stay up on current trends in the industry? If they look at you like you have, 3 heads, what? Then maybe that's, you can tell about how motivated they are when you ask questions like that. So you really have to ask different questions when you're interviewing people, I think, to really get to that point and find those A players, because it's all about attitude and the skill. If they're in have years of experience doing whatever, or maybe at a hospital you have the luxury of training people. Sometimes you have the budget to do that. At surgery centers we usually don't, because it's very lean, so we don't have the ability to train a new operating room nurse, for example. I know I trained for 6 months at a hospital to be an operating room nurse. But this piece, is important, because what happens when you don't have A players? If you have one negative person in your department, and they're like a malignant melanoma that just spreads to everyone, just one person. So this part is really important. And I had a mentor that said, she coined it, she said, that's a butt nurse. They're an excellent nurse, but, so they're good at, maybe in the operating room, and, the doctor thinks they're awesome. I love this. That happens all the time. The doctor, I love them. Yeah, but outside of the room, they suck, because they don't want to do anything else. They only want to, work with Dr. X, and, they're awesome in there. But then you need them to pick cases. You need them maybe to do some infection control duties. You need them to do you need them to do other things with teamwork, and they can't do it. And that's the kind of people you want to try and weed out. Mentor. You are a mentor, I'm sure, to all of your staff. And this is really important, because especially if you have young staff that's, new, I know probably each of you can think of a mentor that you had in your career that was really important to you and enabled you to be more successful. So think about that when you're interacting with your team, and how you can mentor them and it also gets them to do things the way you want them to, or things that you need them to do if you take the time to do that. Be a change agent. How many of your staff likes to change the way they're doing things? If you say you're going to get a new medical record, a new EMR, panic ensues, or something like that. Anything that's major change, we in nursing don't like it, usually. But is stuff changing every single day in healthcare? Yes, every day, and you have to change and you have to adapt. You have to be ready to keep up with it, or you're going to be out of it, because it's just changing all the time, especially in the operating room. I think we have all kinds of new things coming all the time. Everything's improving and changing, and you have to be proponent of that. And again, that's another question that I like to ask in interviews. How do you deal with change? Give me an example of something that changed and how did you deal with that? And it's interesting to hear the response to that. And you may weed somebody out pretty well with that one question. if they I hate change, And of course, the worst thing to hear is that's the way we've always done it. Great, isn't that nice? But we might need to change how we're doing it. And that's your job as leaders to help do that. Coaching is really, really important. And one of the things that we do a lot, because we're so busy, we see something happening with a teammate, or, I like to call them teammates. My previous company, we called them that. It took me a while to get to that. But teammate, how do we get, they do stuff, but we let it slide, right? Because we're busy and they do something that we don't like, or we know that we should be, but you don't take the time to address it right when it happens or close to that. If you do find someone doing something that's not how you want it to be done or not how it needs to be done, the best thing you can do is get that person quickly right away, as close to when that happened as you can. Coach them on it and say, hey, I saw, or you do this, or I heard about this. This is, why that's an issue. You could tie it to your values, tie it to your mission, tie it to whatever. And it's not about them, it's helping them to improve. And if you do that on a regular and routine basis, it'll be a lot more successful, because that's hard. It takes time to do that. But if you wait and then it builds up, and then you're really, really frustrated with that individual because they keep doing that. And the reason they keep doing it maybe is because you haven't taken the time to correct them and kind of guide them in the right way. Influencer. You're a great influencer. Just like I said before, everything you do influences in one way or another. Could be a positive influence, or it could be a negative influence. And how do you want that to be? So you have to think about yourself in this particular piece, and how are you projecting to your team. Results leadership. Of course, this is where your boss and the executives at your organization are usually focused on the results. First and foremost, clinical excellence. What are our metrics for clinical excellence? And that should be the number one conversation. And sometimes I know in organizations that I've seen, it's not always the number one conversation, but it really should be. Because without that, what do we really have if we don't have clinical excellence? So we're looking at all of our metrics, and our HCAHPS scores, and our infection rates, and our readmission rates, and all these things. And I know at our organization, since we have had this number one ranking and for 10 years, this is something we talk about all the time, because we have been fortunate to have the lowest infection rates in the industry and things of that nature. So these things, you have your goals and you motivate people and you talk about them, and it should motivate your staff to think about the clinical excellence if they're really good nurses and other staff. Strategic thinking. This is something I think a lot of times you're so busy with all those things we showed on the first slide that are happening. Are you taking time to think about your strategic planning, whether it be for the month, the year, 5 years out? How do you, allow yourself time to do that? And different organizations do it differently, and you may be required, I'm sure you're required to turn in reports, and maybe depending on what your position is, whether you have business plans for different organizations do it very differently, but are you allowing yourself time to do that? Because often that gets missed because we're so busy with running around doing everything we do day to day. We don't have time at 5 o'clock when you finally sit down to do your work to plan. But it's really important. Intellectual capability. Some people, you know, I mean, just aren't there. Some people are able to process things and move on and get things done really fast, and other people are not. So you have to take that into consideration as well. Achievement orientation. This is another thing you can get to in your interviews with people. How motivated are they? Do they like to get stuff done? That's GSD. Get stuff done. That's what you need. You need people who are going to get stuff done and that are not just going to be like in the previous session. I heard, you know, the people that want to drag out their day because they don't want to get an add-on. You know, that kind of mentality. Oh, you know, I heard that, and I know it existed everywhere. You've got the, oh, we can't move that fast. We're going to get the add-on. So those type of people, you know, and how can you affect that? Because this really impacts your overall operation. And then growth orientation, we already talked about that. Business acumen and financial management. I know if you're nurses, and I was like this too, and I had my MBA, but I still was not a finance person. And you know, when you first become in nursing leadership, does anybody, like, it's like, woo, you know, you're used to the clinical stuff and, you know, all of that, but the financial piece is another piece that you are responsible for most likely. And how do you work on your acumen and improve your skills in financial management? And I think there's, you know, you look for leaders at your organization in finance, in business, to help you, you know, figure out, because you're responsible for major dollars at your organization, likely between the staffing costs and the supply costs. The OR supply costs is, as a percent of the budget of a hospital, supply costs huge. So how do you improve your management in those areas? Tools for success. As we talked about all these different things going on, prioritization of your time becomes really, really important. And what are you spending your time on? I like to go look at my calendar every once in a while and kind of see what I'm really spending my time on. Is that driving to the big things that I need to get done? You know, you should have top priorities for your year. You know, your boss has probably given you in your evaluation your top goals for the year and what you're being measured on and everything. So take a look at your calendar, and is what you're spending your time on driving to those goals? Is it really? You can usually find a lot of stuff that you're spending time on that you probably don't need to be spending time on. I told this to my own boss because he's a millennial and he's got his calendar is over scheduled. They loved it. And I look at his calendar, he has not one single minute all week, like from 8 a.m. till 6, maybe 7 a.m. till 6. I'm like, what is this? I said, I'm buying you a book called Essentialism, you know, which really tells you how to look at what you're doing and are you really spending time on the right things. So that kind of goes to capacity building as well. How do you build capacity for yourself so you can get those important things done? So we'll talk about some of that as well. And as everything in our whole career and our professional life, communication is really important. And how does that play into pretty much everything you do at your job? Here, I'm having trouble with this again. So we're going to look at what's your current reality. And this is supposed to be, it would work. So oftentimes you'll have a wide variation in profit, satisfaction, and clinical results. This looked familiar from like school, like about, you know, the bell curve of grades or whatever, but you may have a wide variation. What would you like to achieve? So our goal in leadership is reduce variation and improve the mean. So we improve all those results that we just talked about. The patient satisfaction, the financial results, the volume, whatever it may be. Oh, there's the rest. See, It looks better when the clicker works. So the root of the variation, in my opinion, is leadership behaviors. And so that we're going to go and delve into a little bit more detail on some of these behaviors. And this, I'm sorry, is very hard to see because, first of all, we're a little blurry. Basically, what this shows, there's treadmill leaders and there's fulfilled leaders. And what's the difference between those? So kind of a treadmill leader is doing things like putting out fires. They're blaming other people for things that happen to them. They take credit for other people's ideas and success, even though they didn't get it. They operate from a transactional perspective. They have a lack of team alignment. They fear change. They try to do everything. They don't delegate. They miss deadlines. They have a lack of heads-up time, which we just talked about in terms of strategic planning. They have urgent situations all the time because they had a lack of planning. Think they know it all. They're reactive, not proactive. They always have reasons for failures. And they have a lack of team clarity. Stuff like that. Those kind of behaviors, treadmill leader. You're always running, but you're never going anywhere. So when you think about that, a fulfilled leader, which is what we aspire to be and want to be, does things very differently. They're collaborative. They hire and develop teams. They give credit to the full team. They delegate. They share information. They entrust others. They're strategic minded. They leverage support services. That's what I talked about before with your finances. You know, if you're not sure and you're not, maybe that's not your strength, seek out other people at your organization that is their strength and improve your skills in those things. In finance or whatever it may be that you could, you know, in a hospital, there's so many support people that you can lean on to grow yourself. Resilient. They understand that culture matters, and really culture is critical, and it's all the things we've been talking about kind of go to the culture. Open growth, live values. They put a value on clinical outcomes, creating enterprise value for the whole organization, enhancing the brand of the organization. Focused on top priorities. They are having an intense desire to win, you know, and that's a different kind of mentality than just running on a treadmill. So hopefully if you print these out, you can read this a lot better, because believe me, it's very clear on this screen. Unfortunately, not so clear on here, so I apologize for that. But hopefully you'll get the idea of what I'm talking about. So you want to go from doing it all yourself. I have had people with offices like this, but this, not me, but this is not what you want to be. You want to be figuring out how to delegate appropriately to your team. And, you know, I've worked with a lot of leaders at my facility, CEOs of ambulatory surgery centers, and some of them at times said, do you ever think that, well, if I want that done right, I have to do it myself? And hopefully that's not the case. If that's always the case, maybe you don't have the right people under you, or you're just afraid. What I've found with some of my folks over the years, they're afraid. They're just afraid to let go of stuff. And then I try and work with them on that a lot when I see people that are doing that. They don't have good work-life balance, and, you know, it becomes like really unhealthy. So I work with them, and once they figure it out, oh boy, I can really trust people to do some of this stuff. Amazing, the difference in just their whole perspective. They have time to like spend with their family, maybe do some fun things that they like, and, you know, they're a lot less stressed, their anxiety levels down, all these things. You just have to have the people you can trust and let them do it. Let them do things. You can't do everything. Sorry, this is so hard. So, does that ever look familiar? You're just running around, you have days like you feel like this on the left here with the hair on fire, you're running around, or you have people that work for you that do that. Maybe operating room nurses, charge nurses, whatever, that are doing this, because there's always something. And some people really like this. They thrive on this type of thing, or they just want to be a crisis all the time, and you don't want that. It's not a healthy culture. So again, you want to empower your team to be able to solve their own issues and give them the latitude and have their back that if they can solve their own issues. And sometimes they're going to screw up when they do that, but you know, that's what happens to everybody. You have to give them the latitude. It's just like your kids. I just went to high school orientation for my son who started 9th grade today. And they said that. They said, let your kids, because you're like, high school kids should becoming independent a lot more than they were before they went to high school. And I'm sitting there going, yeah, I'm good at doing this at work. I don't know how good I am at doing it with my own son. But again, they have to make mistakes and learn. That's the only way they're going to learn and develop as leaders and as employees. So you want to go from a lack of clarity on roles to setting clear expectations. This is part of the communication I talked to before, because a lot of times you have very clear in your mind what you want people to do, but is it very clear to them? A lot of people, and I've seen it many times, they say, well, I need to have this. I need you to do this. But they're not really clear about the where, when, how, when do I need this by? That's a real simple one. A lot of times you tell people to do things and you don't set a clear deadline. Oh, I need this by this. And if you're not able to get it to me by then, let me know why. The more details you can give about what you expect people to do and how, when, who's responsible, who's accountable, the better your result is going to be. And people are much happier also when they have that clarity. Because I think it's just human nature. You think in your mind, well, I know that's how I would do it. And you have people that work in very different ways. Everybody's got a different personality. Everyone learns differently. Everybody's in a different generation. You got to communicate differently to different people. And that's really a skill that you have to develop, is to figure that out. How do you need to set the expectations? And sometimes it's very different for different individuals and what's required to get them to do things and be successful. So you go from accepting the status quo. I love this one because these companies, Blockbuster, as you see on the left there, to expecting to win. Blockbuster was everywhere. And then they just did not adapt to the changing technologies and streaming and Netflix and Amazon Prime and all these other things, and they didn't do it. So what happened to them? They ceased to exist. Totally obliterated from the marketplace, pretty much. Oh, in your town. All right, well, not totally, but pretty much totally, because the CEO was in Fort Lauderdale, actually, and that's where it was based, and so we heard a lot about this. But they just, it was in a constant decline, and they just didn't react, and it's kind of like another example you could use is Toys R Us, which is coming back now, but under a totally different model. But I mean, they had to close them all because they didn't adapt, they didn't change. And it's important to share those type of examples with your team, because then it gets them thinking, oh yeah, if we don't do this, we could adapt. If you read Modern Healthcare or Becker's or anything, every day hospitals are closing. Every day I read it. And big hospitals that you wouldn't think about, like Hahnemann last week. I'm like, oh, Hahnemann's closing. People, it gets their attention when you share these type of things with your staff as to why this is important. I think it's helpful, And we expect to win. You know, we want to win. We want to be the best in our community and, you know, in our state, whatever. You always want to set those high bars and set those expectations to win. And to do it, you have to change. You have to change, because otherwise you'll have the big yellow store closed on your front of your building. Oh, and there was another one. I'll give a real quick example of this. It was in the ambulatory, and I don't know if anyone here's been in the Tampa area, but there was this really big laser pain institute, like a laser spine. This place was like, it looked like the Ritz-Carlton of surgery centers. It had 3 hotels around it where they would bring all these people in for pain procedures. Place looked like it was just on top of the world, all this stuff. All of a sudden, I mean, like this, overnight closed and laid off every single employee overnight. Huge place, huge building, very expensive. I mean, literally overnight, all the doctors, not just the staff, all the physicians out of work overnight with no recourse because they're gone. They're done. So, you know, it's just important to think about these things and why all these behaviors and why your leadership is important to prevent your facility from having that happen. And again, I'm sorry, this is so blurry. It's so clear on here. What we wanted to go to, oh shoot, what happened? Oh, sorry. This over here, if you're spending tons of time managing your team, you know, you're not spending as much time on other things that you should be doing, like developing your team, the growth activities. You know, maybe you're spending time on patient complaints, physician complaints. If you're spending a lot of time on this stuff over here on the left, clinical issues, you want to move to this side where you're spending time on growth activities, executing your vital few, which are those top priorities that I talked about before. What are the top priorities on your development plan for the year? Developing your team, you want to spend a lot more time than 5%. And then all these other things you want to spend a little bit of time on. So that's what you want to get to. This is like the ideal state. So how do you make that happen? God, this clicker is driving me crazy. Now what's going on? Oh, okay. None of my little stuff works because of the clicker, so I apologize for that. So key leadership characteristics. You want to have high-performing teams, because the higher performing your team is, the more time you have to do your job to execute your top priorities and grow the organization. This didn't come in the way. I'm going to put it all up there that way. So you want to go from here to here. You want to be going upwards all the time. You don't want to be on the trajectory like Blockbuster. A growth culture. And you have to plant the seeds and watch them grow and do things to cultivate your team and your facility to grow. Full accountability. That's really important, because a lot of times, and that's part of the setting the clear expectations. Who's really accountable? And what are your people accountable for? Do they know that? Do they understand what that looks like? And what are you accountable for as a leader? So the impact that all these things should facilitate the highest levels of patient care at your facility, which is what we're all wanting to do, in addition to, of course, making money, but we want to have the highest levels of patient care. Inspires your team to go above and beyond. You want them to come in and be excited to be there. In surgery centers, I've been fortunate in that environment. People are really usually very excited to be there, and we've been lucky to have that little culture. It's a lot smaller than a hospital, and we have a family atmosphere, and you know, everybody comes in usually excited. There's always those, but you know, you want them to be excited to be there to do their job. That's one of the things I noticed at HSS, and it's an acute care hospital. But the culture is so vibrant there, and that's one of the reasons that they have had the performance metrics that they've had over the last 10 years and why they've been ranked #1 in orthopedics. And that'd be the same if you know, for overall acute care hospitals. I'm sure if you work at the Cleveland Clinic or the Mayo Clinic, it's that type of culture as well. It's the same thing. And it all starts at HSS with our CEO. And then all the leaders down the chain are like, I mean, I've never been anywhere where everyone is so helpful. I was new to the organization in April. I mean, every, you know, senior leader, whether it's the CFO, the CNO, the COO, all the SVPs, I'm a VP, everybody above me is incredibly helpful. Then I go look, I took a tour of Central Sterile, the 110 FTEs that I mentioned. These people are so excited to be there. Whether they're cleaning instruments, whether they're inspecting them under the microscope, whether they're packing the trays, whatever they're doing, they're excited about it. And it shows in the results. So all these people, the CEO of our organization tells everyone, everybody in this organization is a leader. You're a leader, maybe you're a custodial employee, you're a leader. You're a leader, you're keeping our facility clean. You're a leader, you're in housekeeping. Everyone is a leader because they're leading what they're doing. So if you can create that culture and inspire your team, it's going to benefit everyone in the organization. Assisting your physicians to be successful in their practices. That's something that we've had to do over the last few years, at least in ambulatory surgery, because I'm sure your physicians come in and tell you, even at the hospital, how much less money they're making. And, you know, all these things because of reimbursement pressure, because of Obamacare, because of whatever, you know, and because helping them to be more successful in their practices brings you more patients at your hospital or your surgery center. So partnering with your physicians in that way. How can you make your workplace extraordinary? If you do all these things and you come in like that, and I always come in like it's the best day ever. My husband's like, how come I can't have the work arena at home? Because then I get home and I'm like, oh. Yeah. But at work, you know, you got to leave all that stuff behind that's going on, because everybody's got lots of stuff going on in their life. And that's something else. You know, your employees have stuff going on, and being empathetic to them, but also, hey, let's make our workplace extraordinary. And you're going to be a big part of that, is how you lead them and how you project yourself as a leader. Now we'll try. We're going to see if this works. I have my Dallas video. Let's see. This is just a little video of leadership styles, if we can get it to work. It worked in my, let's see. Aha. Oh shoot, it's not showing up. Gosh. It's on here, but it's not on here. Need AB. It's showing up on here and not here. Let me see. My killers will not take no for an answer. Let's see. Good suggestion. You can see I'm not. Let me start that over. Okay. These little black boxes, they're called telephones. I'm going to let you know a little secret about these telephones. They're not going to dial themselves, okay? Without you, they're just worthless hunks of plastic. Not the little M60 for that.
Trailer is pull the trigger. He's the telecom. It's like a beach. My killers will not take no for an answer. Hell no. No. I do. I've seen it. You have shown it to me. You have shown this coaching staff, your teammates. You have shown yourselves just exactly who you are. When you take that wheel, you gotta lay it hard on the line. Don't prepare it. Prepare it. Most times, most interesting, most extraordinary person. You are capable of amazing things. Because you are this special. So am I. So am I. I want this mark all the way down to Times Square. Never lost an American in space, but sure so I'm going to lose one on my watch. Failure is not an option. Now you will speak only when spoken to. And the first and last words out of your filthy sewers will be certain. And you know you understand that. Yes, sir. Oh, yeah, I can't hear you. Come on, like you got there.
Okay, so from that, you can see, a few different leadership styles. And what kind of leader do you want to be at your facility? And I thought that the Lego movie one, that might work really well with some of your difficult surgeons, You are amazing. It really might work well with them. But I thought that was cute. And really what I want you to think about is what kind of leader are you going to be? What kind of leader are you? What kind of leader do you want to be? And how can you get there and transport yourself and your team to a higher level? Thank you very much. Does anybody have any questions before we have like a few minutes, about 5 minutes. All right, well, thank you very much. My contact information is at the end of the presentation if you ever want to reach out to me, and I'll be here today and tomorrow. Thank you again.